All right. Hi, good afternoon, everyone. I'm Kim Selfon. I'm the Medi-Cal and IHSS advocate from Bedsec Legal Services in Los Angeles. So I want to thank you for all being here this afternoon and hanging out. I work from the advocacy perspective, and we wanted to talk to you a little bit today about CalAIM benefits and what they are and how they can benefit you. If you haven't heard about CalAIM, don't worry, probably hardly anyone's heard about CalAIM. It's a fairly new benefit that started in 2022, very quietly, and it's being rolled out over the next 5 years. This is a benefit for Medi-Cal participants. And the point of this program is to innovate and improve the delivery of managed care services in the Medi-Cal program. CalAIM stands for California Advancing and Innovating Medi-Cal. And the point of this program is for Medi-Cal to use innovative ways to support people's health outcomes. Traditionally, Medi-Cal has been a program for health benefits. Medi-Cal pays for home care benefits, right, through in-home supportive services and other supportive services. But this program allows Medi-Cal to pay for other services that support people's health. I was talking to an attorney in our office, and she talked about this story. She works in a medical legal partnership, and she had a client who was a patient, went to emergency room. They thought she was having a heart attack because she was having symptoms like a heart attack, but it was actually a panic attack because she was being evicted from her apartment and she was having a panic attack. She never had one before. She didn't know what it was. CalAIM can help in situations like that because CalAIM can help pay for rent in an apartment. If someone's homeless, it can help pay for first and last month's rent, that kind of thing, which supports her outcome, right? Her health outcome. If she's housed, she's going to be healthier. So CalAIM allows for things that aren't usually covered under healthcare, like paying for rent or other kinds of, you're going to hear all kind of creative things that CalAIM can pay for through this process. So it offers these 14 optional community supports, which we're going to talk about today, those supports. And it also offers care management to help coordinate community supports and help connect people using Medi-Cal to other community services. The thing about CalAIM is it's hard to access. Next slide, please. Because every managed care plan, I call them HMOs, but they're called managed care plans, right? Health insurance plans. Everyone has different community supports than they've opted into. So depending which healthcare plan, managed care plan you're in, your supports may be different. They're not standardized yet across the state. You will get a copy of this PowerPoint. You can access this PowerPoint, and this has links to the different health plans and what kind of community supports they can offer for you. And I'm going to be coming back to talk to you about how to appeal if you're not given a community support that you want. But the next, what's your name? What? Jessica. Jessica is going to speak a lot about the community supports, right? Supports offered and the case management and how that all works through the CalAIM program. So if you are on Medi-Cal, if you get Medi-Cal, you may be eligible to use these new CalAIM benefits.
Thank you. No, you're fine. Hi, everyone. I'm Jessica. I'm the manager of community-based care management services. So I oversee the implementation and oversee just day-to-day services for some of these benefits. Right now, I oversee ECM, but I actually have a counter manager that oversees community supports. So I'm going to try my best to answer as much questions I can for community supports because I really do think those are going to be the benefits that will really assist you in some of your needs, where ECM is, we're going to link you with someone to assist for your care. So I'll give more details on that. Oh, next slide. Thank you. Okay, so what is ECM? So ECM in general, it's another care management program or case management program. But the reason this particular program is unique is because the state or Department of Healthcare Services, we don't want the care management to be housed at the managed care plans. We want you guys to partner with agencies to provide that case management. So in Santa Clara County, more particularly with our health plan, we've partnered with 28 agencies and we continue to make partnerships in the community. And these agencies are probably going to be the nonprofits or government agencies that you are already utilizing. So we have partnerships with like Gardner Family Services, Institute on Aging. We also have Silicon Independent Valley Living, that's also part of our network. So these organizations are contracted and you can receive case management services from them. As mentioned, what the intention for ECM is to really help you in 3 focuses of your health. Primary care, so assisting in coordinating your care, providing you medication reconciliation or adherence. So kind of going over what medication you're taking or connecting with your primary care. Behavioral health is another one. We know that it's really hard to tap into behavioral health services. So your case manager can help you connect with behavioral health, rather that be being on the phone with you. So you can do call behavioral health together and get that assessment and then follow up with that referral. Or even work with your behavioral health provider to understand when your next appointment is, etc. And the third part of health that a lot of us don't talk about in healthcare is what we're calling social determinants of health or social risk factors. A lot of us stay sick because we don't have our primary needs addressed, and that includes housing, food, education, income. And so part of our ECM is to bring in the social factor in this whole person approach. So the lead care manager is tasked to assist with those 3 facets. So it's no longer just assisting with diabetes medication or, talking about your asthma. It really is saying, okay, I see that you have this chronic issue or chronic health problem. I see that you're also have maybe housing needs. At the same time, we also see that you haven't been referred to behavioral health. Let me work to connect you with all these services. How many of us have had issues with the healthcare system? Because I know I have. My parents have, right? Like we've all had those issues where we get turned around or told, wait on the call. So your ECM provider is contracted by your managed care plan to assist in that facilitation. And part of that is not just providing you someone to assist with that facilitation, but at your managed care plan, Department of Healthcare Service is also saying we have to do better in creating systems in our organization that allows us to connect between different health entities. Because how many times have you said, well, no one's talking to each other in this county? Like I talk to one person and repeat the same information to another agency. So the state is also asking us on the backside to also talk to each other to make it easier for our patients or our members. Next slide. There's different populations we're targeting for today's audience. We're looking at adults living in the community who are at risk for long-term care. So this is through our process, we can pre-identify members who can get the automatic authorizations or basically approved for the services without having to call the health plan and say, I want the service. When you're automatically approved for the service, you'll get a letter in the mail that says, hey, we identified as you needing or potentially benefiting from a lead care manager. And then we've assigned you to one of the 28 organizations that we're paying for the service for. With that being said, you can also switch. If you get a letter in the mail and you're like, well, I don't know who this provider is, I want to work with somebody else, you can call the health plan and say, I want to switch. And so through this population, again, we work to create, we look through our data to see who's the most at risk for long-term care and then pre-qualify you for the benefit. Next slide. Through this service, we provide 7 core services, outreach and engagement. So when you're assigned to an organization, they'll outreach you, call you. Sometimes they'll do door-to-door knocking. So if they say, hey, we're with your managed care plan, definitely call your managed care plan to verify. But a lot of the times you'll see actually on our provider directory, you can also verify if they really are contracted, or you can call the helpline, because we also want to be safe out there. But we do have providers that will do door to door and say like, hey, you've been identified. Can we help you with anything? Once you enroll, you do have to verbally consent to this program. Your case manager will provide you the remaining 6, which spans to, providing assessments for you to see what your needs are, helping you with transitions, and then at the bottom, coordination and referral to community and social support services. So again, looking at those social risk factors. Next slide. These are our 28 contracted providers. As mentioned, we try to be as expansive as possible, and we're still growing. Come October, we're going to grow our network even more. So if you see an agency where you're like, well, I like their case management there, they have really nice nurses and social workers that really assist me, and I think they would be a great add to your network, please let us know. We would love to hear that feedback. Here you'll see, as mentioned, like Institute on Aging, Silicon Valley Independent Living Center, SourceWise is a provider within our network. And then we have some of our federally qualified health centers also included. Next slide. How to refer, you can either call Santa Clara Family Health Plan's customer service and simply say, hey, I wanna know more about ECM, and then someone on my team will give you a follow-up. You can also submit the form yourself. It's on our website there. So there's a ECM referral form. You're gonna complete that referral form, and then we're gonna do the rest from there. You can mail it to us, you can fax it to us. The easiest way that I found out that I find for members is to call customer service, because then we'll call you back within those 1 to 3 business days to see how we can link you up to services. Next slide. This is the referral form if you are interested. It just lists all of our populations of focus. So we have them from at risk for long-term care to at risk for homelessness or homelessness. We also serve like foster care youth, etc. Next slide. Community support. So as mentioned, there are 14 new, they're not yet permanent benefits, but they are support services eventually, or we do expect them to be permanent in the hopefully next coming years. But right now they are available. And lucky for you guys, our health plan actually provides all 14 support services right now. We won't go over all 14 due to time, but we will highlight a couple for you that you may be interested. Next slide. As mentioned, these aren't permanent Medi-Cal benefits yet. And I do want to highlight, this is also available for people who are on DSNP, which is Dual Connect. And these are your health insurance in which you've merge them together, your Medi-Cal and Medicare, and they're with Santa Clara Family Health Plan. So you don't have to only be Medi-Cal, you can also be Dual Connect to tap into community supports. For ECM, it is right now a Medi-Cal benefit and not open to Dual Connect members. The purpose is to establish a foundation for implementing community-based services into managed care plan, managed care, long-term supports and services. These are complementary to ECM, but you don't have to be enrolled in ECM. Again, the ECM is meant to connect you, where community supports is the actual services themselves, and you don't have to be enrolled in ECM to tap into these. Next slide. So as mentioned, all 14 are available at Santa Clara Family Health Plan. They may differ if you are with Kaiser or Anthem. Something I do want to make clear is because sometimes you'll hear I'm with Valley Health Plan or I'm with etc. If you're with Kaiser, you're with Kaiser. If you're with Anthem, you're with Anthem. If you're with anybody else, you're more than likely with Santa Clara Family Health Plan. Through the payment system, they end up at Santa Clara Family Health Plan. The The last one, short-term post-hospitalization housing, won't go live until January 1, 2025, but that will be available. But as you can see, they do have a wide range. We have different housing supports like housing deposits, nursing facility transitions, community transitions, all the way to sobering centers, respite services, to day habilitation programs. Next slide. So here, we'll review a couple just for timing. I think, do I have like 5 minutes left? Okay. Here's a couple. So the first one is recuperative care, or better known as medical respite. These provide short-term integrated and clinical care for individuals who no longer require hospitalization, but still need time to heal from their injury. So we do provide this service. And as again, this is short-term if you need kind of like a transitional placement. And then there's short-term post-hospitalization housing, very similar as well, provides those who do not have a residence and who have high medical or behavioral health needs the opportunity to continue their medical, psychiatric, or substance use recovery immediately after exiting an institution or inpatient institutional setting. Next slide. Medically supportive or medically tailored meals. Some of you guys have already tapped into the service into the community, and many of those times we've actually partnered with those agencies already. So, you know, sometimes you'll see us all come into full circles, and that's what we're seeing right now, is that if it's already in the community, we've probably reached out to that provider, and that provider is part of our network. Personal care and homemaker services. This provides temporary assistance similar to IHSS for individuals with activities of daily living needs who need otherwise not remain in their home. And then there's respite care services. These are short-term services provided to caregivers of those who require occasional temporary supervision to give release to the caregiver themselves. Next slide. Day habilitation program. So this provides services in or out of a person's home to assist them in acquiring or retaining employment and improving self-help, socialization, and adaptive skills necessary to reside successfully in the community. And then I think this is the last one I'll go over. So environmental accessibility adaptation, or home modification simply. This provides services or physical adaptations to a home that are necessary to ensure the health, welfare, and safety to individuals, or enable the individual to function with greater independence in the home. Something I want to highlight that's happening in managed care plan, which is amazing, is that as mentioned, we've had to get creative, right? When did you ever hear your health insurance contracting with a home repair or home modification entity and then billing for Medi-Cal? But there's big changes happening in managed care plan, and really excited to continue this and really expand out to more nonprofits or to community organizations and expand some of those payments outwards. Next slide. How to refer, same like your ECM, you can simply call customer service, and then you'll have someone from that team reach out to you on how to refer into the program. You can also email, you can call. A lot of the times what tends to, I think one of the barriers we do have to address is access. I think eligibility in managed care plans can sometimes be difficult, but this is why we do have teams at the managed care plans that can discuss some of those eligibility factors with you and at least explain it to make it kind of non-regulatory or government speak, and kind of just say, hey, this is what you need to submit so we can get you into the service. Next slide. I think we have grievance and appeal.
So we talked about the community supports offered by the plan. There's a list of them. So what do you do if you contact your plan and they don't provide the community support? Well, you do have grievance and appeals rights, like you do with other benefits. So there's a procedure you should take steps to do to get covered. So let's say we talked about home modifications, okay? You fell, now you need help taking a bath. and you need grab bars in your bathtub to help you get in and out, right? Hey, that's covered under home modifications. So you contact your managed care plan and you say, I want to use the CalAIM benefits and get some home modifications. I need grab bars. And they say, I'm sorry, we're not going to provide that to you. Now you have an option. You could accept that, or you could go through the grievance process. So anytime you make a request and they deny your request, even if they don't send you paperwork, you have a right to file an appeal. So you can request the community support. If they didn't get a notice of action in the mail, which is a piece of paper saying, you've made this request, we're denying it. If you don't get the piece of paper, that's fine. You can still file an appeal with your managed care plan. And if they deny your appeal and say, hey, we still don't think that you need this support, you can file for a state hearing. So you do have appeal rights if they do not grant your request. Now, if your managed care plan is not covering one of those community supports, you're not going to win your appeal. But I know Santa Clara Health, they're covering all of them, right? So if you call and they are denied that, you can file an appeal. I know someone has a question, but I think we're going to hold questions till the end. Next slide, please. So this just talks about a notice of action. Your plan should send you a notice of action in the mail explaining why they're denying something or approving something. Even if you don't get a notice of an action, you can still file an appeal. Next slide. And this is how you request a state hearing if you want to file an appeal. If you didn't get a notice of action, you can still file an appeal. This is on the back of the notice of action. It has these instructions, and you can file it online, by phone, or by mail. I like doing it by phone because you get a confirmation right when you call them, and you can write down the number confirmation. Next slide. These are resources for help if you're filing an appeal. The Managed Care Ombudsman can help you, Healthcare Options, and the Department of Managed Care. So you're going to get all this information. So these are really resources for you. So if you're in this situation, you can come back to this slide to get help. And I want to do a shout out to California Advocates for Nursing Home Reform. They put together all these slides, and we have links to their materials also. Next slide. And these are the resources. California Advocates for Nursing Home Reform is a nonprofit organization that advocates for people in nursing homes and people who get Medi-Cal. And they have a very comprehensive list of how to access CalAIM benefits through each county, at each county, how to apply. Some you have to call, some you have to file online. It has a list of every county and how to get access to their benefits and other great information. So I highly recommend looking at their materials. They're very, very good. Next slide. Source-wise.
Hi, so my name is Alice Tran, and I'm a lead case manager at SourceWise, the Enhanced Case Management Program. Next slide. So currently, SourceWise, we're on the ground, so we're the case managers that are serving the clients in the community. If you go with SourceWise, you would be assigned to one of two of us. Currently, we're serving Anthem Blue Cross and Santa Clara Family Health Plan. We don't currently have a contract with Kaiser because I think they have their own. Next slide. So right now, this is our team. So currently, we're a very small team. We only have 60 clients that we're serving at this moment because we only have 2 case managers. And at the end, you can see the photos of 2 of them, one myself, Alice, and the last one is Jamiru. The first 2 photos you see is our outreach team. So this is the team that will go to door to door, or they will call you on the phone. If you show eligibility to be a part of our program, like Kim mentioned, or Jessica mentioned that sometimes their clients are flagged as being eligible for ECM. So that's when my outreach team will go out to the community. They'll either call you, and if they can't reach you, then they'll go out there and they'll see you door to door. And right now, our program director, SFA, is trying to expand our program. So our population that we focus on right now is adults, dementia, and homelessness. That's your specialty. Next slide. So we have 2 success stories, basically, which is clients that we've worked with. This is Miss Jane Doe. She's 65 years old. She's Spanish and English speaking female. And these are some of her health conditions: major depression disorder, alcoholism, hypertension, bad knee, hyperthyroidism. And then these are all the programs that we linked her with. So when she called us, she basically said, we did her assessment and she said, you know, I have needs and I'm not able to connect to these organizations or these agencies. Can you help me? One of those is IHSS. So we help them get a reassessment with IHSS, and we help them gather supporting documents. For example, let's say you needed something for your physical therapist to prove to the IHSS social worker that your needs have changed. So we'll help you gather that information for your IHSS social worker from your doctor or your PT, and then send that out with you. Establish care with your PCP. Some clients don't know who their doctors are, so then we help them connect with their doctors. And then some clients, either they drove before and now they can't drive because of their medical condition. So we connect them with Santa Clara Family Health Plan to get transportation in order. We also connected this person to Gardner Health since she did have some mental health needs. And we got her into a recovery program at Community Supports. So these are kind of some of the things that we'll link you to. And it's not just giving you a phone number and handing you off into the community. We follow up with these, on a monthly basis, if not on a weekly basis, depending on where you fit. And this client basically said, she thanked everyone for, thanked the case manager with me during this journey where many would not have put up with my relapse. I know you will be here to help me during this difficult time. And the second client, next slide, is Miss Claire. She's a 56-year-old English speaking female. And these are some of her medical conditions. And then we also linked her with IHSS. And she didn't have a caregiver. So then we linked her with Public Authority Registry to get her the registry list. And we kind of provided some care coaching as well. And then she needed an orthopedist. So we helped her connect to her primary care doctor to get the referral to an orthopedist. Also, this client also didn't have transportation, so we connected her with Anthem to get transportation. Times our clients have which appointments are when, so we'll, call the provider to follow up to see, when was your next medical appointment and do you have a transportation scheduled for that one? So we help our clients do that as well. And this client in particular didn't, she fell, she didn't have grab bars in her bathroom. So we also helped connect her with community support. We found out if she was eligible, and then we filed the referral form and got her connected to a third-party agency that provides home modifications. So for this client, she basically said, you and your organization sound like a godsend to me, getting my life back together. I haven't been successful with my lack of motivation to carry this task out on my own. But with your guidance, I know where to start and I know I'm not alone. Next slide. I think that's it. So this is our office, but You could always give us a call and then we will connect you with a case manager, with an agent to move forward.